Hi everybody, it's Adam, the geneticist at Verdure Healthcare. So today we're going to have another question and answer session for the non-invasive prenatal test. Okay, as you know by now, I'm actually one of the participating consultants for the Nutfield Council on Bioethics. So this bioethic forum is for people to discuss what are some of the genetic tests or tests in general in the medicine world, and of course one of the most debating question will be around the non-invasive prenatal test. Okay, so if you're interested, you may please visit www.nutfieldbioethics.org/blog/NIPT-private. Okay, so they give you a lot of basic information on what NIPT is and what are the concerns that people will have for this particular type of test. Okay, so today here is the question. Is a very interesting one. Okay, so of course these are some of the anonymous contributors. They ask this question on the forum. They say 43 spontaneous pregnancy. Okay, OB, which is the obstetrician gynecologist, just informed me NIPT screening find me high risk 91/100 for T18. Okay, schedule for CVS. Okay, next choose. I am 12 weeks pregnant now and was instructed by doctor to start baby aspirin due to my blood pressure history. My doctor says hospital high risk doctor will call me beforehand to tell me if I should stop baby aspirin 24 hours before CVS. But I haven't got the call yet. Wondering if any of you have similar situation and do you stop baby aspirin before CVS? Okay, now just some background information. CVS is a test to actually been done on the amniotic fluid for the baby. Okay, so the doctor will extract that and they will do a genetic test on this particular sample. But for NIPT, just for your information, all we need to do is to take the blood sample from the mother and then we'll be able to run the genetic test to see if the baby is healthy. So for this particular contributor, she was very unfortunate to have 91 out of 100 for T18. Now, T18 is Edwards syndrome. It's not a good sign at all, particularly if 91 out of 100, 91% chance of getting T18. Okay, so today let's break this question down. Let's break things down a little bit so that we can make this session very meaningful. First of all, what is trisomy 18? What are the characteristics? What is the impact? Will the baby be born healthy? Okay, what are the causes of trisomy 18? Why NIPT test is more accurate? What should an NIPT test include? Now, this is extremely important. What is the next step after NIPT if the results shows high risk? Okay. Can a general counselor analyze an NIPT report? What qualifications should a genetic specialist, genetic counselor, geneticist, you name it, should have? Okay, so I'm going to answer all these questions one by one. Okay, just a bit of a background builder. Every human being is made out of cells. Okay, we have a lot of cells, the hair cells, skin cells, and everything. So within this cell, there is a command center telling what the cell should be doing. And within this command center, of course, there will be the commanders. And these commanders, they are the ultimate things that are responsible for everything that we have in our body. And these are called chromosomes, okay? So everyone should have 23 pairs of chromosome in the body. And as you can see from the first pair all the way to the 22nd pair, they should look identical. They should look symmetrical, and each piece, the right hand and the left side, should have the same pattern as well. Okay, so the first pair is the largest and the lengthiest pair, and the 22nd is the shortest one. And on the 23rd pair, we have the sex chromosome. So if you have an X and a Y, you are going to be a boy. If you don't have a Y, you have two X's, then you are a girl. Okay, and this is also one of the reasons why we're able to tell the gender of this baby, of your baby, as early as 10 weeks, because we don't really need to look at sonographic images. We just need to see the chromosome in order to know if you are currently having a baby boy or baby girl. Okay, so what is trisomy 18? Now, this is a very nasty disease. Trisomy 18 is a chromosomal disorder in which 3 copies of chromosome 18 are present rather than 2. So I just mentioned that we need 23 pairs or 63 pieces of chromosome. But now this abnormality is when the 18th slot over here has 3 chromosomes, okay? Trisomy, that's why it's called. And we cannot actually have any more or any less chromosome. So there was once a client that asked me, Adam, if I were to get 1 extra chromosome, will I become a Superman? Unfortunately, the answer is no, because humans are designed to be made with 100% precision, okay? Maybe we can have 1 or 2% of variations, okay? Maybe that's already too much, but not an extra piece of chromosome, okay? That is simply too much. Okay, trisomy 18, also called Edwards syndrome, is a condition, or more specifically, a chromosomal condition associated with abnormalities in many parts of the body. Okay, many parts of the body, multi-system failures. Individuals with trisomy 18 often have slow growth, okay, before birth, all right, and a low birth weight. All right, so these are the 2 most direct characteristics. So what else? Okay, affected babies usually have heart defects, abnormalities in the other organs, okay, that develop before birth. Other features of trisomy 18 include a small head, okay, in proportion to the body, abnormally shaped head, a small jaw and a mouth, a small mouth, clenched fists and overlapping fingers, okay? And these are very serious kind of symptoms. Due to the presence of several life-threatening medical problems, okay, many individuals with trisomy 18 die before, meaning stillbirth, or miscarry within their first month, all right? Okay, so if you can relate it back to the question that the blog contributor asked, since she has like 91% chance of getting T18, trisomy 18 on the baby, then most probably the baby will not make it through birth, okay? So here is a summary of the kinds of characteristics that trisomy 18 babies will have. Okay, so about 5 to 10% of children within this condition live past their first year. Okay, that's not a high percentage. And these children often have severe intellectual disability. Okay, so what kind of heart disease will trisomy 18 babies have? Okay, so the most kind of obvious symptom will be ventricle septal defects, meaning to say the wall in the heart, okay, we have 4 chambers in the heart, okay, so one of it, the septum, will have a hole in it, okay, and that means there will be blood flow problems. So this is, I think, one of the most serious kind of symptoms. And then, of course, the other ones will be short sternum, and then umbilical hernia. And then, okay, one more thing that I need you to know is that for trisomy 18, okay, there is a chance of the skull being defected as well, all right? So that's why there is small head and often abnormally shaped heads. All right, so let's move on, okay, to the next question. How can trisomy 18 happen? What causes it? All right, with this, let me ask you a question. Where does the baby come from? Okay, does the baby, will they just happen by chance, pulling out of thin air? No, we need to contribute our gametes. Our gamete meaning to say the eggs from the mother and the sperm from the father, right? It's as easy as that. But what happens if these sperm or eggs have a defect? Okay, normally if the mother contributes a healthy egg and the father contributes a healthy sperm, then the baby should be healthy, all right, in that sense. But what defines a healthy gamete? Meaning to say, the mother will only contribute half, okay, or 50% of what she have in terms of chromosome to the baby. And of course, that same goes for the father as well. But if there is any chance of either one side of the parent contributing extra chromosome to the baby, for example, in this drawing here, the mother contributed two chromosomes, a whole pair of chromosome to the baby, and then the father contributes as per normal, then this situation will be known as trisomy. Okay, this can happen at any chromosome. It can happen at chromosome 1, chromosome 10, chromosome 20, 22. It can happen literally on any chromosome. But we are just now talking about trisomy 18. Okay, so moving on from that, now you know why and what causes trisomy 18. Okay, just one more thing before we move on to this slide. Okay, so you might have a deeper question. So Adam, how can we make sure we are contributing normal amounts of chromosome instead of contributing extra chromosomes? Okay, one way you can go about this is to manage your lifestyle. Make sure you're living healthy before you get pregnant. Because have a think about this. Where does our sperm and egg come from? Okay, our body, right? We make sperms and eggs. So don't blame anybody for it. So we have to take our own health into our own hands. So you eat healthy, make sure you get enough rest for the body to work properly, make sure you control your stress hormones, something like that. I know it is easy said than done, but you need to have an awareness of it. Okay, so many people got pregnant accidentally without even managing their own health and resting times, and that is why there is a high risk for these things to happen. Okay, and so we do have actually, we will have services to help strengthening and conditioning your reproductive health, and that is a particular strength with Dr. Terence. She particularly prepares couple for a healthy pregnancy, okay, and her medications are specially formulated to pinpoint and increasing the couple's reproductive health, especially for the quality of the eggs, the ovulation, all right, the quantity of the sperms in male, as well as its quality. Okay, so if you're preparing for a pregnancy or if you're already having problems with trying to get pregnant, please do see Dr. Terence, and she will most definitely offer you a very detailed diagnosis. Okay, so for the NiPT, what should that include? Okay, the most bare basic package should include trisomy 21, which is Down syndrome, trisomy 18, which is Edwards syndrome, Patel syndrome, which is trisomy 13. Okay, so these are the really bare basic ones. Okay. And they should also include sex chromosome aneuploidy. Now, these are most likely not life-threatening kind of like chromosomal abnormalities, but we would like to include that for you. And it's very essential as well to determine whether or not this baby will have any kind of problems reproducing. So, sex chromosome, as we've mentioned before, it is on the very last pair of the set of chromosome. What are the conditions that can happen? Okay, XO, XXY, XYY, and triple X. I'll go through these further in a while. And also at Verdure Healthcare, we will check for 84 most common genetic diseases across Asia. Okay. So 84 including, for example, thalassemia, Duchenne muscular atrophy, and etc., many more, okay? All right. In fact, at Verdure Healthcare, we don't just check for 1, 2, and 3 trisomies. We check the entire set of chromosomes, from the first pair all the way down to the 23rd pair, which is the sex chromosome. Okay, that's what we will do for you. And in addition, we will include 84 most common genetic diseases in Asia. We'll check that for your baby as well. Okay, so this is Down syndrome. As you can see that there is 3 copies of 21 chromosome here. Edward syndrome, as we have just gone through. And then Patel syndrome, which is trisomy 13. And there we go. There are 3 copies of this chromosome here. Okay, let's have a look at the risks. Okay, so this is the percentage risk, okay, and this is the maternal age. So we are now studying this graph here, and you might have heard this before. Some people would say if the maternal age is older, there is a greater chance of getting an abnormal baby. And this so-called abnormal baby, let's funnel it down to trisomy 21, which is Down syndrome, and all the trisomy we just mentioned, 13, 18, and 21. Okay, so let's have a look at this red line over here. Okay, it combines all the condition that we just briefed through. Okay, so at the age of 30 over here, which is right over here, you don't really see any risks at all. But when it comes to 49, okay, between 30 and 49, the line increases exponentially. Why is this the case? Okay, now this relates to how eggs are made, all right? So remember I said before, age of 30 and below, the eggs are still quite young, okay? The quality of these eggs, unless you ruin it on purpose, they shouldn't be bad in quality. That is why there isn't many chance of getting a Down syndrome baby, for example. But as the eggs get older, when you age, okay, there is a greater chance of the gamete, which is the egg, being defected. So in that case, you might be passing on extra chromosome to your baby than you should. Okay, so here at the age of 49, the chance of getting one of these common trisomies is actually around 13%, which is really high. And if we just look at chromosome 21 trisomy, okay, which is Down syndrome, at the age of 49, a group of these, the maternal age, okay, that is around 9%. All right? And of course, we know the baby's gender, as we've mentioned before, so you might want to prepare in advance how to, welcome this baby girl, baby boy into the world. All right, so let's have a look at something called sex chromosome aneuploidy. Now, this is a less common kind of chromosomal disease, but most likely not threatening, but still we need to pay attention. Okay, so the first one we're going to look at is XXY. And to term that properly, this is called the Klinefelter syndrome. And since there is a Y chromosome, we know that this is a boy. So what he's going to get if he's being affected by this disease is sexual immaturity, meaning to say that his reproductive organs might not develop in full, and as a result, that will be azoospermia, which is no sperm being produced, breast swelling, or more of a feminine characteristic. Okay, so let's take a look at a female example. Let me pick one. Okay, XO, that is a very serious one because this is called Turner syndrome, whereby this girl over here with short stature, webbed neck, that is just the characteristic, is sexually undeveloped. Okay, is sexually undeveloped, meaning to say if on a more serious end, this baby girl might not have any reproductive organ at all. Okay, so some research says that. Okay, anyhow, so this is Turner syndrome. Okay, Klinefelter for the boy, Turner syndrome for the girl, and then less serious one would be triple X. You pretty much cannot see any characteristics at all. Okay. She's tall, thin, she might be facing menstrual irregularity. So that is not a very easy symptom to spot unless you do a genetic test. Okay, so we now understand what chromosomal abnormalities are, but you might still have a question. what does this 84 microdeletions or 84 most common genetic diseases in Asia, how does that differ from what we just talked about, chromosomal abnormalities? If you have that, that means you have been understanding what I'm talking about very well. So here, microdeletion means a small piece of chromosomal material has been missing. And you cannot see that when you analyze the whole set of chromosomes altogether, because these deletions are just so micro and so small, okay? So for example, thalassemia, it isn't a big chunk of chromosome missing. Otherwise, you can see that already in the chromosomal analysis. And because this is so small, we have to use a technology called next generation sequencing in order to line up all the genetic code inside the chromosome. Only then we are able to compare normal humans' gene to the sample, okay? And when we do that comparison, we will be able to see, okay, there's bits and pieces missing over here. Is that going to be lethal, okay? If it is, then we need to categorize what variation it is and what kind of disease does that lead to. Okay. So moving on, how does NiPT work? Okay, so actually, the moment you get pregnant, there will be a connection with the mother and the baby. Through what? Through the placenta and the umbilical cord. So now here's the connection, all right? Okay, so through this connection, very often the baby's DNA will be floating inside the mother's blood, all right? And we call this DNA fragments. So when we have this, when we understand this characteristic, we only need to take the 10 milliliters of blood sample from the mother through here, the arm of it, this vein here, okay? And then we are able to do the DNA separation from the mother's DNA and the baby's DNA, and we are able to test for the baby, okay? So CVS fluid, okay, is the fluid around the baby over here. That's what's suspending the baby in the sac, okay? So if, let's say, NiPT, okay, tests for something high risk, we would recommend CVS or amniocentesis to actually extract these fluid in order to test for another time. Okay, so previously when we don't have NiPT technology, this is the only way to get a final diagnosis, all right? Okay, but NiPT now is more than 99% accurate, okay? So if NiPT shows something unfavorable, we would recommend you to get an amniocentesis, but that is not 100% must. You can base your decisions on whether you want to continue with this pregnancy based on NiPT. But here at Verdure Healthcare, the lab that we work with, we have included a complementary amniocentesis should NiPT report comes up positive or any high-risk results, okay? All right, and this is how amniocentesis is done. The mother lies on the gurney, the hospital bed, all right? Okay, and then the doctor will find a sac, okay, the space over here, in order to poke the needle, guide it through the ultrasound, and then take the amniotic fluid in there for the same kind of genetic test, okay? That's why we don't recommend it. All right, so let's move on to the final part of this talk. Can a general counselor analyze an NiPT report? Okay, well, let me give you an answer straight up. Okay, I mean no offense to any other professionals out there, but a general counselor is not allowed to answer or to analyze an NiPT report because they are trained to give psychological support to people, okay? But NiPT is specifically linked to the field of genetics, medical genetics to be specific, okay? And that leads to the second question. All right, so what qualifications should a genetic specialist, geneticist, genetic counselor have? Okay, so for myself, okay, let me give you a bit of a background about myself. I have two professional qualifications from Tsinghua University. One is histology and the other one is pathology. So histology studies somebody's tissue, okay, the tissue structure, the cell structure, and then pathology studies the origin of the disease, the characteristics of the disease, why does it make somebody sick, okay? And my continued education is from University of Beijing, and I studied pathophysiology, all right? So basically that is just the mechanism of sickness or illness. And I'm also qualified from the Royal College of Surgeons of England with a postgraduate certificate in surgery. So with this qualification, I am originally certified as a surgical instructor, but I do not teach surgery, okay? I am focusing on genetics. So, okay, given all these qualifications, still I am not allowed to talk to you about genetics, because if I were to talk to you about genetics, I need to be further certified. And I did with Stanford University. So I'm a certified geneticist by Stanford University with their Stanford Genetics and Genomics Certificate, okay? But still, after your qualifications on genetics, as a geneticist, it still doesn't mean you can offer people genetic tests like nobody's business. You need to be further qualified. So we follow the US, okay, we follow US regulations, and that means we have to get further certifications. So with that, I am certified by Harvard Medical School, especially in genetic testing and sequencing technologies. All right, so as you can see, in summary, all of these, you have to be certified as a medical personnel, okay? So that is the baseline. Okay, you can be a doctor, you can even be a nurse, it's okay. And literally any kind of medical qualification, okay? As long as it is in the field of medicine, it is okay. Then what you need to do next is to get certified by a properly recognized university in the field of genetics, all right? And after you get yourself certified in the field of genetics, because you want to offer people genetic testing, you have to have the skill of introducing the test to the couples, to the patient, or to whoever you're offering the test to. And then you need to understand the underlying technology behind what kind of test you're offering. Okay, so that is why there are so many layers. And then in addition, I'm also certified by Johns Hopkins University in the field of genomic data science. Now, this is an extra qualification, and again, because I often talk to labs about how to expand our package, how to offer you more contents in the genetic test, okay? And then how can we make sure the data are 99.9% accurate, and we constantly improve our genetic services. So this is an extra kind of qualification. It's not necessary for every genetic counselor to have, but with this I can understand more gene data better, okay? So that is pretty much what, discounting this one, that is pretty much what a genetic counselor would need to have. Okay? Further still, we need to be able to tell you that our practice is recognized. Okay? We can have a stronger qualification, or we can have, okay, we are a super brand, by the way, but still, because this is medicine, it has to be regulated. So we got the membership certification from the American Society for Reproductive Medicine, and they have recognized us for our contribution in the field of this reproductive medicine. They recognize our practice. Okay? So, okay, the lab that we work with is called DNA Lab. Okay, the name is straightforward enough. So they have been in Malaysia for a very long time, okay? And they have, over the years, they've won so many awards and recognition. And with us, we have 19 years of experience in this industry. And we are ready to provide you with the best NiPT service. And with that, in 2022, we have been selected. We are very proud. We are very thankful for all of your supports that we are a Reader's Choice Award under 2 categories. One is the Fertility Specialist Center Kuala Lumpur, and we just can't tell you how proud we are. Okay, so that's Dr. Terence, that's me, and that is, I believe, one of the editor from Baby Talk Mama Papa magazine. Okay, so, and furthermore, I can't believe this. Okay, the second category is the NiPT and genetic counseling service. Okay, so they have specially picked us. In fact, you guys have picked Verdure Healthcare, voted for us as one of the best NiPT and genetic counseling service center in Malaysia. Okay, they didn't bracket Kuala Lumpur, Selangor, and that means throughout the country we have been selected as a kind of like national representative. Okay, so I would really love to use this chance to thank you everybody for voting us, and we are most definitely ready to increase our quality of service to the best possible we can. Okay, and then furthermore, another happy piece of news is we have sustained super brand status into 2022. In fact, as far as I know, any registered entity, meaning a company, they can only have 3 years of super brands consecutively. So please keep your fingers crossed for us. Let's hope that we can make it to the 3rd year. Okay? And yeah, well, if you're currently pregnant, or if you're planning for a pregnancy, please do give us a call. Let us help you prepare for the healthiest baby to come. Let us be a part of this happy journey for you, and you can give us a call. We do have IVF and genetic consultations, we have natural pregnancy consultations, and we even have our VHC formula fertility supplement hotline as well. So please do give us a call, and we would love to hear from you. Okay, one final thing, this video will be put on YouTube, and so please subscribe to our channel. All right, share this video to the friends and families in need, and stay tuned for our next video on the chromosome or on the question and answer about NiPT. Thank you once again. Have a great day ahead.